Good evening. My name is Wunmi Sokan. I'm a family nurse practitioner and currently a DNP student at UMass Global. And the presentation today is an innovation video project. The problem to be discussed is schizophrenia and is all about medication non-adherence. Schizophrenia combines symptoms, behavior impairment, and several other causes. It is considered a chronic mental illness that affects people's thoughts, behavior, and feelings, which becomes stressful for family members, friends, and likewise individuals. It is considered one of the leading causes of worldwide disability. It's a chronic psychiatric illness. According to the National Institute of Mental Health, it usually starts for females in their early 20s to early 30s and males in late adolescence to early 20s. Medication non-adherence remains one of the biggest problems, and this increases the number of relapse cases, thereby causing repeated visits to the hospital and raising the service cost. Improvement in medication adherence can help alleviate most of the issues patients encounter with schizophrenia, thereby improving patients' quality of life. When patients don't take their medication, there's a possibility of relapse and they end up in the hospitals. Background of schizophrenia. This, the disorder was first identified in the 19th century by some European psychiatrists who discovered that the disorder started affecting the young and became chronic over time. Prior to this period, very little was known about schizophrenia. According to the National Institute of Mental Health, approximately 20 million people worldwide and approximately 1% of the US population are affected by schizophrenia. The lifetime prevalence of schizophrenia in the United States was estimated to range from 0.25% to 0.64%. Despite schizophrenia's low prevalence of median value 15.2 per 100,000 persons per year, it is considered a significant contributor to the world's disease burden. In the early 1900s, society shunned schizophrenia patients. Many were not treated nicely due to suspicion and fear, and this worsened the patient's condition coupled with lack of treatment. A lot of patients wouldn't even go for treatment because of the way they were being treated in the society. Based on the study conducted to estimate schizophrenia prevalence, as shown in graph 1, the researchers concluded that at a specific time point, 4.6 out of 1,000 people with the disease over 12-month period, 3.3 per 1,000 have the disease during surveillance. The lifetime prevalence was 4.0 per 1,000, and the lifetime morbid risk was 7.2 per 1,000. The graph shows the prevalence of schizophrenia, and it is plotted based on an estimate per 1,000 by sex, female and males. Due to little knowledge about the disorder, treatments were based on trial and error prior to discovering medications. The introduction of different medications did not come without side effects. A lot of patients faced many side effects from those different treatments. Unfortunately, the process of trial and error used to find the correct medication and dose is still practiced today. The medication side effects remain one of the primary problems. Patients with schizophrenia do not adhere to medication. Because of the side medications, a lot of them don't take the medications. And of course, what happens? They end up in the hospital. The financial cost of caring for schizophrenia is disproportionately high compared to other health conditions. And the emotional and mental burden of family members are really significant. Many fail to seek treatment due to societal stigma. Patients with schizophrenia are stigmatized in the society. Treating schizophrenia can be very costly. The disorder consumes about one third of the total cost allocated to mental health in the United States. Innovative collaboration. During this period, three talented individuals working specifically with patients with schizophrenia and related disorders with vast experience in various fields, ranged from 10 years to 25 years, were interviewed. Firstly, a nurse practitioner with 25 years of experience in psychiatric practice. Secondly, the psychologist had 15 years of experience working specifically with patients with schizophrenia and related disorders. And thirdly, the therapist with 10 years of experience working with patients with various mental health issues. Informal and face-to-face interviews were conducted with these three talented individuals on questions about the use and acceptance of mobile information technology, specifically related to the use of SADA app in treating patients with schizophrenia. And this is compared to the use of the electronic medical record or electronic health records. The collaborators' input and decisions on this innovative technology. The nurse stated that she will pick mobile information technology over EHR as electronic health records because of the easy accessibility of the mobile information technology, but she does not consider it ethical. However, she also reported that most of the nurses in her generation were more inclined to rely on patients' observation to assess care and treatment rather than depend on information through mobile technology. On the other hand, both the therapist and the psychologist were more comfortable with information technology innovation. They prefer mobile information technology to the electronic health record. These two collaborators used informative mobile technology to obtain personal information about their patient's health. The providers caring for and treating patients with schizophrenia rely very much on mobile information technology. This being that they're able to reach their patients in real time as they put information on the app. The providers are able to reach out to them and able to provide care for them as needed on a real time basis. The chosen app, SADA, this app is for patients with schizophrenia. The app provides specific real time information on medication and symptoms. The app was introduced to make it easy for patients with schizophrenia to record specifics and details about their symptoms, their moods, medication use, clinical appointments, and several other functions. The mobile app is compatible with iOS and Android services and it can be downloaded at no cost. It is free. The app's simplicity would encourage patients to use it as directed, especially for medication reminders. Because this is the reason why a lot of schizophrenia patients end up in the hospital for lack of using the medication. Innovative solution, the SADA app. The app is a very useful and effective in that it provides information on symptoms and medications for patients with schizophrenia. The providers are able to reach out to them. As soon as these alerts are delivered to clinicians, they're able to reach out and provide necessary treatment for this patient. The app allows patients' health information to be imported from other health apps, and this allows for collaboration. The providers are able to see what other providers treating these patients are doing, and are able to work together to get a better patient outcome. The app allows patients to track their routine, their mood, and symptoms constantly. It helps patients connect to online moral support circles, and this is a big help. For patients suffering from schizophrenia, they're able to reach out to other people for support and are able to help each other. It also allows patients to maintain daily operations journal. This way, the patients are able to record the daily journal and be able to share with their providers, who is able to see what they're going through on a daily basis and be able to come up with a solution, treatment plan for this patient. The app really also helps monitor and better manage schizophrenia very well. These are some of the pictures of the app, and it just shows right there on the left. It shows that the app can help manage and monitor schizophrenia and related disorders with all the tools in one place. So it's not so clear, but you can see there's the medication tracker, and here it is, my journal, where they can write everything they're going through. And this really allows um, the providers to be able to see real time what is happening to them and be able to provide a solution for them. On the right side is another picture which also shows all the tools can be seen once the app is opened and the patient is able to just access whichever one he or she really needs to use. In conclusion, the use of mobile technology is noted widely as a potential tool used to coordinate care for early diagnosis of psychosis. The use of smartphones has become very popular, with an increase in the number of ownership of smartphones among patients with schizophrenia. There's a need for new solutions when caring for patients, according to Camacho, especially those with early psychosis. They are using mobile technology and smartphones to support care in early psychosis because the earlier this disorder is the earlier the disorder is diagnosed, the faster the treatment comes. The patient is able to start treatment as early as possible. The app's simplicity will encourage the patients to use it as directed, especially for medication reminders, because that's one of the reasons why these patients end up in the hospital when they don't take their medications. Antipsychotic medication non-adherence in patients with schizophrenia in remission can lead to relapse, causing repeated visits to the hospital and high health costs. And this is why the use of the app is able to help reduce medication non-adherence because it is reminding patients to take their medications. So patients do not miss out. They don't forget to take it. They take it as soon as they're reminded by the app. These are some of the references that were used in putting the presentation together. And this brings us to the end of the presentation. Thank you.